Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. But our starter question, I believe, has to do with this. If you don't mind, I'm going to read it. I have watched all your videos in Autism Live. I've been trying to connect with you for the last 2 months. I have a son who just turned 9 years old. He is verbal, ASD diagnosed, hyperlexic, fascination towards letters and numbers. He is writing in the air more often.
Oh, right.
I don't know how to divert that. I am trying different methods, but nothing is working. I know that it's not hurting anybody. I feel it's self-stimulatory behavior. However, in a group class, it's disturbing and shifting the focus. He will have some math problem or counting that he needs to finish writing in the air to continue or rejoin the session. Example, in a taekwondo class, all of a sudden he starts writing in the air. That way he won't focus in class and it disturbs the other kids as well. Please help me on how to handle this or guide me if I am looking in a wrong perspective. Please, and you know, she talks about how we can connect with her, but she says, I appreciate everything you do. It has helped us lots of times. Can't thank you enough, Dr. Granpeesheh. So.
Sure, so I have a lot of thoughts about this.
Yeah.
And like it's, you know, we can talk about it. Perseveration as a whole is kind of an interesting thing in autism because nobody really knows what is causing these types of what we call ritualistic, stereotypical behaviors, or self-stimulatory is what it's often called in behavioral lingo. But I think it's important to really think about what could be causing it in each child, and also just have an open mind because I've seen so many different things, right? So on this one, it's kind of well, first of all, let me just back up and say that in general, my experience has been that when there's perseverative behavior, a lot of times it is similar to what we see in obsessive compulsive behavior, OCD, which the compulsion, in OCD and obsessive compulsive behavior, there's an obsession, which is a thought, and then a compulsion, which is an action that is taken to calm that thought. That's how OCD works. So in other words, there are germs everywhere is the thought, and I will wash my hands repeatedly is the compulsion, and that's just an example. So with kids with autism, sometimes we see that where we don't know what the thought is, obviously, that is provoking it, but there's a kind of repetitive behavior that needs to take place, like it just has to happen, and until that happens, the child is agitated. And it's almost like they just have to take control of their environment by doing this, right? And so, and remember, with OCD type behaviors, there's an element of anxiety where until I've done this compulsion, the world is about to fall apart. You're anxious about it. So, it could be a compulsion of that type, in which case you want to focus on it just like you would anxiety. And, you know, we've talked a lot about anxiety, and generally the treatments for anxiety are most often some form of medication, and then, I guess, you know, calming, meditative types of exercises. But it's very hard when a child is, and I think this child is 9, and did the parents say if they're verbal or not?
They did not.
Yeah.
They did not say that, but the child is 9. Oh, no, he is verbal. You're right. He is verbal.
Okay. And so the thing is that, like, sometimes with a child, it sounds like this is a child who might be able to do this, which is allow them some other more acceptable, I guess, way of expressing that need. So perhaps if the child has a way to, like every time they have some sort of compulsive thing, I don't know, like they'll take something from one pocket and put it in another pocket. Just something that allows them to keep track of the compulsive thought or whatever the anxious thought is. So, and then they later are able to either write it out or do whatever it is they need to get it out of their system, right? I mean, so in other words, behaviorally, you are allowing it, you're just getting it under control. You're getting it under what we call stimulus control, so it's kind of like contained in a specific time frame, so it's not interrupting all their other behaviors. So when it occurs, let's say in the middle of a class or in the middle of a sports activity, they wouldn't stop and be, doing all this kind of stuff. They would just actually just remember that, oh, I can take one marble and put it in my other pocket. That means I have as many as I have here. I'm going to do it multiple times later. Yeah. So it's kind of like a delay, or like they could reset a watch, or something that allows them to keep track of it might be satisfying enough. I do recommend that you see a physician and try to consider antidepressants, which are the medications for anti-anxiety, and consider that, because that will kind of take the edge off and the need to do this type of behavior right when they need to do it. So that's kind of the most, I guess, common reason that children will engage in that kind of behavior. But you also have to realize we're not really clear on how our kids see things or perceive their environment. And when I first read this question, which had come to me, I was like, okay, this is really interesting, because I've seen a lot of kids do error writing, but now that I'm like so interested in this other thing that's happening, the spelling phenomenon, where kids, nonverbal kids, are able to spell by putting their hand in letterboards. It just immediately made me think, is this some motor form of the child trying to communicate? Although it is a verbal child, so they have a different mode of communicating, but somehow this, ability to communicate is being triggered somehow. I don't know. So it's worth observing more and trying to figure out. For example, is the child actually, can you tell what they're writing? If you stop them at that moment and ask them what they're writing, what will they tell you? Is it just something kind of ritualistic, like something they saw on TV, or, something that they're rotely repeating? Or is it something that is in context to that particular environment that they're in when they're doing it? I'm kind of always open to investigating those types of things more and understanding them more, because in ABA, or in general in behavioral psych, what we're trying to do all the time is manage behaviors so that it's more socially acceptable. And we all do that, right? We all have to be socially acceptable in order to live in this world. You can't do crazy things all the time.
Well, you can't walk up to the pizza counter and slap the person at the counter
just because you feel like it, or you have some need to do that, right? So it becomes really important to manage our behaviors and kind of keep ourselves within a certain set of rules, but at the same time, we always want to find out what is causing the need, the urge, the desire to engage in that kind of behavior.
But this is one of the things that I ultimately respect about you so much, that I think there are a lot of people that would just be like, oh, that behavior is this.
It's not acceptable, let's get rid of it.
Or just label it and go, it's this, instead of saying, I don't know for this individual what this is, why don't we find out?
Right. And I think that's...
Which I respect, that's the place that you always come from, saying this is an individual, he's doing something, we don't know enough about it yet.
And why? The why is so important for every kid.
Yeah, and the OCD conversation, I don't know if you've seen, I don't know whether it's actually Keanu Reeves, and maybe somebody can write in and tell us, but there are a series, it's like a meme, there's a series of reels that have this guy who either is Keanu Reeves or looks like Keanu Reeves about OCD. And there's one where, and I, am someone who has OCD. So I was like, ooh, it's a little too close to home. They show him in his apartment, and he's ironing something and he's getting ready to leave. And he gets to the front door and, he's like, did I unplug the iron? And so then, he goes back in and he checks the iron and makes sure. He gets back to the door and he's like, I don't know, did I really check it? So he goes back in and he unplugs it. He's like, okay, now it's done. He gets back to the door and he's like, but did I do it? So he goes back and he's like, I'm going to take a picture of it, which I have done. I'm going to take a picture of it to prove to myself that in fact I have done it. And then he gets to the door again, and I think then he goes back and he cuts the cord to the iron. He's like, now I'm good, I can go. He gets almost to his car and he goes back in, and the next shot they show is of him carrying the iron with him.
Yeah.
And I was like, okay, because
That's funny.
it's that thing.
Yeah.
And here's the thing that my son will say to me. He'll say to me, what are you anxious about?
Yeah.
If I,
Yeah.
you know, because I don't have to check the door 5 times every day.
Right.
Because most of the time I'm well enough now that I don't have to do that.
Right.
But every once in a while, I'll be like, I have to go check the door.
Right.
And my son sits in the car and he waits, and I come back and I check the door and I go, I'm not sure that I checked it.
Right.
And I'll go back to check it again. And I might do this 3, 4, 5 times. And by the last time I get in the car, my now adult son will say, okay, what's really going on?
Yeah.
What's really upsetting you, Mom, that you're focusing it on the door? Because he's been through this with me enough, and then I go, okay, what am I feeling anxious about? But you know, I'm a 60-year-old woman with an adult child who's been trained to this so that he's my therapist. He shouldn't have to be. But to be able to do that with a 9-year-old, like, wouldn't we love to be able to do that and go, what's really going on? But I think it's important as the people who love him around him to be thinking that way.
Yeah, absolutely. And you have to realize that getting to a point where you can describe your anxiety and talk about it is a completely different level than a lot of people. A lot of people who are experiencing these types of things are either A, not aware of how compulsive they are, or B, it's too debilitating for them to even want to try to do something about it. I mean, there are people who have become completely agoraphobic and will not leave their home because of what you just described.
Exactly.
So it really, again, depends on the level of that it hits you. You know, it can be very severe for some people.
Absolutely.
But the whole thing with, you know, this I just want to make sure that you are actually, like we're calling it, writing. Is he writing, or is he just doing this because the visual of moving your hand or your finger in light produces a particular sensory experience, which he could also be doing?
Brian has also written in and said, I understand, listener. My son has varying obsessions, which includes in the air writing and sketching out words, and it must be completed start to finish before anything else is possible.
Yeah, and that's a lot of, and so in those types of scenarios, what you are trying to do, and again, this goes back to like my saying that it has to be fair. The reason that I say, you know, consider the use of medication is that it is more fair when it's easier for the child or the person doing this to stop. Right? When they're on medication. When they're off medication, it becomes a very, very challenging experience to not satisfy your obsessions with a compulsion. That, like, you know, the thing about it has to end, I have to do this. Yeah. And it starts to be debilitating in so many different ways. There are kids who, for instance, will be very late because their homework has to be absolutely perfect, and you can't have one erased thing or one crossed out. You know, and that becomes a part of their lives. They can't make a decision because any kind of decision could potentially have something wrong with it. Yeah. I don't know. There's a million different things. I mean, I had a child who had to look at certain things 10 times, and that's all they did. I mean, it can get out of control. And the concept is, like, for this, you'd want to try to help the individual not complete it, but be able to, you know, visualize the completion or visualize something that's calming enough so that they can move on.
Yes.
But that's very hard to do if you don't have any kind of medication to help you.
But hear what she just said, that, you know, for them to be able to not finish it and still be okay. Because I think what a lot of people do is just go, no, you can't finish it. Right. And then the anxiety goes off the charts.
And I mean, I have a child right now who has lots of ritualistic behaviors, lots. And it is very preventative from us doing anything else. Like, he has so many that they are constant rituals, and they make it very, very hard for him to attend school, to
Yeah.
respond, to do all these things because he's just so engaged in these rituals.
Amazing.
Very
Hard. R has said, I sent an email about yeast and digestion a few weeks ago. Did you send it to me, R, or is that the email that you got that you were talking about?
No,
Because I didn't get one about yeast and digestion. So R, I don't know which email you sent it to, but the best email to send to get on this show is send it to me, Shannon, at autism-live.com. And I apologize if you sent it and I'm sure you feel like we're not listening to you. That's not the case. We'd love to listen to you, so please, Shannon at autism-live.com. I want to shout out to Melody, who's writing to us from 𝗃𝗔𝗢𝗄𝗃, Europe, which I finally looked up yesterday to see where it was, because I clearly did not know where it was yesterday. I did not know it's at the end of the Iberian Peninsula, south of Spain. I was not aware of this, but now I know many more things about 𝗃𝗔𝗢𝗃 and the caves that you have. Cool. She says that they have good news that her son, that she'll be receiving on the 24th of May a confirmation letter saying that he has autism, an acceptance for both of them that he has it and to be able to move on. She says acceptance is the hardest thing because of his late diagnosis. My son has not been to school since last September. He is 14, so extremely hard for him to acknowledge everything. He cannot attend his school until the child psychologist on the 24th of May gives the diagnosis. And that's very disturbing to me because regardless of whether he's getting or he has a right to be educated. I know the laws are different in different places, but I'm sure that that's been very stressful for him and for you, Mom. I'd love to hear what you have to say about that.
Yeah, I guess I mean, I think it's very stressful for him. I don't even think about the educated part, to be honest. I think about the social effect that it has on him, not being able to attend school, not being able to have peers or children around him, feeling like he has failed at this, like the emotional aspect of it.
Yeah.
And I think, it's very important for him to be able to attend and for the school to, obviously, if a confirmation letter was required, then the school has not made any kind of accommodation for him up to this point. So I'm excited for you that hopefully with this letter and this diagnosis, they will try to accommodate. That'll probably be, honestly, your next challenge because the schools often don't know how to accommodate. So I hope that they're able to do that for him.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.